Hello and welcome back to Health Support, your trusted space for better living through smart health choices. Today, we're talking about a topic that doesn't always get enough attention: male-specific cancers. These are types of cancer that only affect men. We'll explore what they are, who's at risk, what signs to look out for, and most importantly, how to stay ahead with prevention and early detection. This could save your life or the life of someone you love, so stay with us. What are male-specific cancers? Some cancers affect both men and women, but others are unique to the male body due to the presence of specific organs like the prostate and testicles. The main male-specific cancers include prostate cancer, testicular cancer, penile cancer. Each of these cancers has its own risk factors and symptoms, and knowing them can make all the difference. Let's take a closer look at each one. Prostate cancer, the most common male cancer. Prostate cancer is the most common cancer in men after skin cancer. It affects the prostate gland, which is responsible for producing seminal fluid. Key facts: most common in men over 50. Risk increases with age, family history, and race, higher in African men. Often grows slowly, but some types are aggressive. Early signs can include difficulty urinating, weak urine flow, frequent urination at night, blood in urine or semen, pain in the hips or lower back. Advanced cases: screening matters. PSA blood test and a digital rectal exam can help detect it early when treatment is most effective. Testicular cancer, rare but highly curable. Testicular cancer mostly affects younger men, typically between the ages of 15 and 40. Starts in the testicles, the organs that produce sperm and testosterone. Symptoms may include a lump or swelling in one testicle, a feeling of heaviness in the scrotum, dull ache in the lower abdomen or groin, back pain or breast tenderness in rare cases. Self-exams are key. Men should regularly check for unusual lumps or changes. Early detection means high survival, over 95% if caught early. Penile cancer, rare but serious. Penile cancer is a rare form of cancer that affects the skin and tissues of the penis. It's more common in men over 60 and often linked to poor hygiene or HPV infection. Signs can include a growth or sore on the penis, discharge or bleeding, changes in color or texture, pain or swelling. Prevention tips include practicing good hygiene, getting the HPV vaccine, using protection during sex, seeking prompt treatment for any unusual changes. Early diagnosis makes treatment easier and more successful. Risk factors and lifestyle connections. Some risk factors can't be changed, like age or genetics, but many lifestyle choices can influence cancer risk. Here's what increases the risk: smoking and heavy alcohol use, poor diet and lack of exercise, obesity, exposure to certain chemicals, unsafe sexual practices for penile cancer. Here's what helps: a diet rich in fruits, vegetables, and healthy fats, regular exercise, avoiding tobacco and limiting alcohol, regular checkups and screenings. Cancer doesn't always give loud warning signs. Prevention and awareness are your best defense. Screening and when to see a doctor. So when should you be screened? Prostate cancer, starting around age 50 or 40-45 if you're high risk. Testicular cancer, no standard screening but monthly self-exams are important. Penile cancer, no official screening but see a doctor for any changes or sores. Never ignore unusual pain, lumps, or bleeding even if you feel fine. Early treatment leads to better outcomes. Talk to your doctor if you notice anything unusual. There is no shame in checking. There is only power in knowing. Hope and advances in treatment. Here's the good news. Medical science has come a long way. Prostate cancer can often be managed or cured with surgery, radiation, or hormone therapy. Testicular cancer is one of the most curable cancers. Even rare penile cancers can be treated effectively when found early. More men are surviving cancer than ever before because of early detection and modern treatments. So don't wait. Stay informed. Be proactive. Final words: your health is your strength. Thanks for watching Health Support. Today's topic might be tough, but talking about male-specific cancers saves lives. So check yourself. Questions. Get screened. And encourage other men to do the same. Hit that like button if you learned something valuable today. Subscribe for more real talk about real health. And drop a comment if there's a topic you want us to cover next. Stay aware. Stay strong. Stay healthy.